what makes America the greatest country in the world.
Soldiers, sailors, Marines, airmen.
Stood up for what was right. First step in solving any problem is recognizing there is one.
It's time we started talking. Pain isn't something we talk about.
All we can ever do for our heroes is remember them, and they gave up two lives. The one they were living in, and the one they would have lived. They gave up everything for our country, for us. Let's pray for freedom and justice.
Only be a war if soldiers are willing to fight.
Less than 1% of Americans serving in uniform. Some veterans not getting the timely care that they need. The good news is that in recent years we've made historic investments to boost the VA budget.
What is it? Why should we care?
We should care about press freedom
because we were informed.
In democratic societies, free, diverse, and pluralist media enable public debates and are essential checks
You don't
on
look
power.
sad. Let's discuss.
Hi guys,
How you guys doing?
welcome to Vet podcast, new episode. If this is your first time listening, then thanks for coming. Today's topic is diabetes. So as maybe you know, diabetes affects nearly 25% of VA patient population, and that is a disease that is a leading cause for blindness and stage renal disease and amputation for VA patients.
Yeah. Diabetes falls under the endocrine system, which is a network of glands that creates hormones to help regulate the body. These hormones control the growth of new cells and metabolism. Some organs, like the kidney, also help in producing hormones. The endocrine system is made up of the hypothalamus, thalamus, pituitary gland, thyroid gland, and parathyroid glands, adrenal glands, pineal glands, reproductive glands, ovaries and testes, and the pancreas. All these parts work together to keep the body in balance.
Yeah, diabetes is a metabolic disease, and for diabetes, the body doesn't produce or properly use insulin. So insulin is a hormone that is needed to convert sugar, starches, or other food into energy needed for daily living. And diabetes is not as commonly believed something that only big people get.
Yeah.
So typically, ERO will conclude that diabetes, the symptoms of diabetes did not appear to a compensable degree within 1 year of discharge from the military. And another common error that occurs when the VA rater or the BVA relies solely on a medical opinion from a VA medical center doctor, who concludes that it would be a pure speculation whether the present diagnosis of diabetes was caused or connected to military service. So that's pretty much what we're getting into today for this podcast.
Yep.
So without further ado, let's go into the topic.
Yeah. So code 7913, diabetes mellitus, is the condition that most of us think of just diabetes. It occurs either when the pancreas does not produce enough insulin, type 1, or when the cells do not respond properly to insulin, which is type 2. Type 3 diabetes can occur during pregnancy, but this condition resolves after the birth and is not rateable. Diabetes can affect many different organs, including the heart, eyes, and kidneys. It can cause strokes, loss of blood flow to the arms and legs, and nerve dysfunction. It usually takes 10 to 20 years for these secondary conditions to develop, but when rating diabetes, keep in mind that the secondary conditions of diabetes can be rated separately as long as they are not part of the requirement for 100% rating. So if the diabetes is severe enough to warrant 100% rating under this code, any other conditions that are caused by the diabetes cannot be rated separately. If the diabetes only warrants a 60% rating, however, those other conditions can be rated separately.
So diabetes is rated 100% if all of the following circumstances are present.
1, it requires insulin injection more than once a day, a restricted diet, and low physical activity level. 2, it causes 3 or more hospitalizations each year or requires weekly visits to a care provider. 3, it causes continuous weight loss and weakness.
So you need to have those three for 100%.
Yeah, and that's not fun. A 60% rating is given if the condition requires or causes all of the following. Number 1, insulin. 2, a restricted diet. 3, a low physical activity level. 4, 1 or 2 hospitalizations each year or 2 visits a month to a care provider. 5, minor side effects that would not make a person unemployable without diabetes. If the condition requires insulin, a restricted diet, and a low physical activity level, then it's rated at 40%. If the condition requires insulin and a restricted diet or requires medication taken by mouth and a restricted diet, it's rated at 20%. If it can be managed by a restrictable diet alone, it's rated at 10%. And code 7909, the diabetes insipidus, is completely different from diabetes mellitus. It is either caused by the body not producing enough antidiuretic hormone or by the kidneys not recognizing and responding properly to that hormone. Without this hormone, much levels of water in the body are filtered out through the urine. It causes a polyuria.
Yeah, and the reason why there are different codes because some disabilities would fit into one better than into another. But sometimes, you will have a doctor that would say that your condition most likely fits into this code. But sometimes it would be on you actually to figure out like what of your conditions would fit in this or that disability. And that's why like we're covering different diabetes in a separate, giving a separate explanation for different codes and different diabetes.
Right, because like we were saying, a lot of people think diabetes is diabetes, but there's a lot of different little levels to it. If the condition causes a polyuria with almost continuous thirst and 3 or more episodes during the past year of dehydration requiring a replacement of liquids through IV, then it's rated at 100%. If the conditions cause the polyuria with almost continuous thirst and 1 or 2 episodes of dehydration requiring a replacement of liquids through IV during the past year, then it's at 60%. If the condition causes a polyuria with almost continuous thirst and 1 or more episodes of dehydration during the year that did not require IV treatments, it's rated at 40%. If the condition causes polyuria with almost continuous thirst but no episodes of dehydration, it's rated 20%.
Yeah, so those are 2 main codes for diabetes. And like right now we'll cover service connection in VA diabetes claims. Actually, what do you need to have in order to establish this service connection for diabetes? And there are many ways, to skin the proverbial cat, but we have 4 major ones, so that we normally cover in other podcasts, but this applies to diabetes as well.
Yeah. Number 1 is a direct service connection. The most common way to direct service connected diabetes to military service is to use chronicity and continuality of the symptomology. Number 1, you got to get a copy of your C file and to show that this condition was during your military service. And without the C file, you're just praying that someone's going to read it and like try to help you out. Number 2, locate all the references to all the early symptomology of the diabetes in the military service and military medical records. So the moment you started having those awkward feelings, and not feeling right, and the moment you started going to the hospital trying to get tested and figure out what the hell was going on, try to get copies of that stuff to show that it started during service and you didn't know where in the hell it came from. 3, get copies of all your private and post-service medical records. So get all your current stuff showing that not only did you have it in service, but you're still showing that you still deal with this issue today. Because those are the 2 major points you're trying to tie in is 1, it happened in service, 2, I'm still bothered with it today. If you could tie those things, you have a damn good shot. Number 4, build a chain. showing that the symptomology of the diabetes that first appeared in service continued from discharge until the actual diagnosis of the diabetes. So sometimes you may have not been diagnosed in service, but you have this guy getting checked out and going through this thing and that thing, or maybe someone did a blood test but didn't even tell you. So check your medical records to kind of show that something was going on. You just didn't really know at the time, but those medical records could help provide that link. 2, the second way you could try to get this as a service connection is secondary service connection. To show that the diabetes is secondary to another condition, there must be some other injury which is already service-connected or which can be service-connected, and which is the cause of the veteran's diabetes. I have seen like a lot of people try to do it in that way, but it's kind of hard to try to show it unless you're trying to claim a direct issue with Agent Orange. As a secondary issue, I'd probably have to argue that it has something to do with your glands that went wrong. So,
or maybe I would probably also look at the studies, and there are no better studies than VA studies, even though they are not so numerous probably than from other health organizations.
Yeah.
But like sometimes you would find weird or crazy studies that would say that sleep deprivation can cause diabetes or something like that.
Yeah, or PTSD causing obesity, which caused the diabetes, might get you in there.
Mm-hmm.
Things like that, but you'd still, at the end of the day, you're trying to tie in the dots to show why diabetes is caused by something the VA's already service connected you for.
Mm-hmm.
So if you could do that, you have good odds, but I think if you're trying to do it as a secondary of something like that, you're probably better off, or at least having better odds if you have a doctor backing you up with it.
Yeah, always.
Number 3 is the service connection by legal presumption. If diabetes is diagnosed in service, or if the symptoms of diabetes present to compensatable degree of 10% within 1 year of discharge, the veteran's diabetes will be presumed to be service connected. So if you went to the hospital within a year of your ETS date or your discharge date, you have an argument of saying this is due to my service if you could still tie those dots. So you would have to show that you were getting tested and everything else, and you still have diabetes today. So if you could tie those dots in together, you certainly have a shot at going for that. And number 4, the major one, I think for most people, is Agent Orange exposure. Not too long ago, on November 9th, 2000, the VA announced that Vietnam veterans with type 2 diabetes would now be eligible for disability compensation. So a good 25 years after the Vietnam officially ended. So for veterans that set foot on soil in Vietnam, exposure to Agent Orange is presumed, and diabetes is then presumed connected to the Agent Orange exposure. This presumption applies to any veteran exposed to Agent Orange, those with boots on the ground in the Republic of Vietnam, certain veterans with the type within Thailand, certain veterans with the Korean DMZ, and some brown water Navy veterans. When it gets into those other groups outside of Vietnam, it becomes kind of iffy depending on the time you were there, the unit you were with, what you were doing, all that fun stuff, which doesn't necessarily make sense to most veterans, but that's the reality. And so always try to get a letter from your doctor saying it's due to your service.
True. So we covered a little bit symptomology by explaining what diabetes is, but you also want to build up the evidence that is up to VA regulation, so it fits straight into VA CFR. So, and when building evidence to prove your VA diabetes claim using some of the methods above, you must show that the symptoms of your condition first appeared in service and continuously appeared from discharge to diagnosis. So for type 1 diabetes, look at any indication in and after the veteran's military service that indicate blood sugar levels that are consistent with the diagnosis of diabetes, or approach diabetic levels, frequent urination, unusual thirst, extreme hunger, unusual weight loss, extreme fatigue, and irritability, of course backed up by a doctor. And for type 2 diabetes, look in yours on the veterans military service treatment records C file or post-service treatment records for any of the type 1 symptomology. And also frequent infections, blurred visions, cuts, bruises that are slow to heal, tingling or numbness in the extremities, or like recurrent skin, gum, or bladder infections. So that would also be indication for type 2, type 1 diabetes.
With type 2 diabetes, it's important to note that in some situations the veteran may experience no symptomology at all. As always, take note of some more common complications of diabetes. As in the graph in this post illustrates, there are a number of medical conditions that result from diabetes, treated or untreated. Always consider a claim for secondary service connection of any condition that you believe was caused by your service-connected diabetes.
Yeah, good good resource to look for symptomology and for studies, especially for the secondary conditions, would be VA Office of Research and Development website. So you can find it at www.research.va.gov and topics diabetes, and just look at the link on the screen.
Mm.
So, and just as an example, there is a DoD and VA study that was done exploring the medical opinion of the relationship between sleep apnea and diabetes. So you would probably see BVA hearings on that topic because you've been denied by VA first, but then you bring this study and eventually it's to the judge to decide whether it's valid or not. But since you have a study to back you up, and especially done by VA, so there shouldn't be questions. So normally you would win those claims.
Yeah.
Yeah. So as always, to end up, do you have any information resource to recommend or share?
Yeah. If you guys get a chance, check out Year of the Vet podcast. Robert Graves was a Veteran of the Year from the DAV, U.S. Marine. Pretty good little podcast about what veterans are doing and how they're inspiring the life around them. Yeah, it's pretty good though.
It's always fun to listen to podcasts, especially when you don't want to scroll through, great resources like Reddit website.
Yeah.
So.
Yeah, always try to figure out what other people are doing.
Mm-hmm. And the good documentary on the topics that we covered today is What the Health, was released not long ago, March 7th this year, 2017. So, and the guy in this movie actually talks about having a proper diet. So with a proper diet, you can reverse a lot of conditions, including diabetes. Pretty sure it doesn't work, 100% for everybody, but at least he did a great job in showing a direct connection between the food that we eat and conditions that we actually
that we do to ourselves.
Mm-hmm. And and a call to action quote or words of wisdom of the day.
Mm-hmm. No bastard ever won a war by dying for his country. He won it by making the other poor dumb bastard die for his
country. So said by George Patton. That's it, folks. Thanks for listening. Until next time, over and out.
Thank you.